My name is Faktorovich, and I'm a refractive surgeon in San Francisco, California. So I'm here at the ASCRS meeting. Very excited to speak about the technology that we've been using on all of our patients who come in interested in LASIK and PRK surgery. So for the past 5 months, I've been using epithelial thickness mapping, scans with OptiView OCT as an adjunct screening tool to screen patients for whether or not they're candidates for LASIK or PRK. The patients who I think especially benefit from this additional technology in screening are patients who we found to have mild abnormalities on traditional screening methods. So patients who have, for example, corneas that are slightly thin, like 498 micron cornea, and otherwise normal on topography. Are these patients okay to have LASIK, for example, if their corneal thickness is good enough so that the residual stromal bed is not compromised, or do they need PRK? Or patients who have a mild inferior steepening, for example, of, say, 1.5 diopters or less. It is in these patients who have these mild topographic or tomographic abnormalities that I found the epithelial thickness map adds an extra level of screening to be able to, for me to guide the patient toward the procedure that would be best for them. So to determine how useful epithelial thickness mapping would be in screening these patients with mild abnormalities on topography or tomography, we've done a retrospective analysis of patients who came in over a 5-month period interested in LASIK or PRK procedures, refractive surgery procedures. And what we found is we had 2 groups of patients, 190 eyes that had normal topographies and tomographies. All patients had normal corneas, and 89 eyes, patients who had a single mild abnormality on their topography or tomography. And when we compared the epithelial thickness maps in these patients, we found that there was no difference in the epithelial thickness map patterns between patients with mild topographic or tomographic abnormalities and patients who had no abnormalities whatsoever. So based on that, we find that these patients who have a single mild abnormality can potentially undergo LASIK safely. There have been a number of studies that found that there is a pathognomonic finding for somebody who has keratoconus, a very early keratoconus, on epithelial thickness mapping, and a very reproducible pattern of what is considered a normal pattern of epithelial thickness mapping. So if the patient has a normal pattern and a single mild abnormality on topography or tomography, then this patient can potentially undergo LASIK safely.